Hello, I'm Dr. Lewis Hassel, professor of pathology at the University of Oklahoma Health Sciences Center, and I'm grateful for your time today. I'd like to tell you about an exciting project that together with a number of colleagues I've been engaged with and have some exciting developments and projects underway in that regard. So it's called the Open Project, and we believe it's one way that digital pathology can bring some solutions to some of the global health and inequalities that exist out there. So to start and introduce this, it began as I began considering some of the gaps that exist as I've traveled around the world. And women like these flower Hmong women in northern Vietnam are hours and miles and even further socially away from the kind of quality of health care that is available to much of the Western world. And it's largely because there just aren't pathologists to serve where they are. Of course, there are other reasons. And so just to touch on what I'm going to cover today, we're going to talk about how this quality and quantity gap may impact inequalities and poor outcomes in the world. And then some of the things that COVID has taught us about remote learning, education, and training, and how that can impact the world for good. And then finally, we'll let you know exactly what the Open Pathology Education Network is and how it's working to provide comprehensive training solution to provide both an improved quality and quantity of capable pathologists throughout the world. So if we look at this big number here, that's the projected number of new cancer cases worldwide in 2030. That's not that far away, only 8 years from now. Well, that represents a 40+% increase over what it was just a few years ago. And that's going to be a significant issue, particularly because that impact is going to be borne and distributed unequally across the globe. So how many of these 27+ million will get an accurate diagnosis and therefore have some chance at an appropriate treatment? Well, certainly not all of them. But the answer to that question is probably most easily demonstrated with this graph here. Now, if you look at this map, you'll see that a great deal of the likelihood that an accurate diagnosis can be rendered if you're one of those 21+ million people, it depends on where you live and how many pathologists are available to serve your needs. If you're in sub-Saharan Africa, your chances are much lower than if you're in North America or Northern Europe. And while we may be pleased at the number of places that are on the green or greenest stages on this map, there still are a lot of important gaps, even in those areas in terms of quality and standardization. And if we think we can get out of this problem by just training more pathologists, well, we're not getting there in the worst areas that need it. If we look at Africa and the number of people that are engaged in active training, this is from a couple of years ago, the only country that comes anywhere close to the projected needs is Nigeria, and maybe South Africa. But so much of the rest of the continent is just a virtual desert in terms of the opportunities for accurate pathologic diagnosis. And without that diagnosis, there's no cure. Well, of course, I know that it takes more than just a pathologist to render an accurate diagnosis. In fact, the whole sequence of a health system is based on a variety of impacts. The population having enough education to recognize when symptoms are important, to move them towards an encounter with a practitioner, practitioners that have the skills and resources to make the diagnosis, the referrals for biopsies or materials, the supply chain that can bring in reagents and the supplies, curative products. And of course, the training for those practitioners who can use them appropriately and make that diagnosis so that eventually the healthy outcomes can be ensured because the correct diagnosis has been made. And all of this depends in great measure upon a sustainable economic system and appropriate management skills at all levels here to appropriately educate, to appropriately deploy resources, to utilize and maintain sustainable resources, and to curate and appropriately devise the treatment and diagnostic resources that one has. And of course, we all recognize that the costly adverse outcomes affect all of us. no matter where we may be. Now, the reasons why this system breaks down are protean. There's just any number of reasons: poor education, cultural barriers, distance, access to primary care, broken supply chains or non-existent supply chains, poor systems, poor management skills, and of course, incomplete or under-resourced training materials, brain drain, and obviously all of these things tend to tip the balance towards adverse and unhealthy outcomes rather than towards healthy, sustainable ones. Now, I can't solve all of these problems, neither can you. But the one area where I feel I can make a difference, and perhaps many of you, is in this aspect of training to get more appropriate brain cells at the point of diagnosis. And that will in turn pull in supplies, pull in resources that can make a change in other areas as well. Well, a variety of other things have been proposed over the last many decades as we've looked at this. This is not a new problem. And these are just some of the ones. I'm not going to talk at all in length about any of these. The references are listed. But there are a variety of bright people, very capable people, very engaged organizations looking at solving some of these problems. None of these solutions is perfect, but they've all made some improvements and movements that will continue to bear fruit. But none of these really address the issue of pathologist workforce shortfalls and the inability to train and to retain pathologists needs a more comprehensive solution. So what is OPEN? Well, OPEN stands for the Open Pathology Education Network. And this grew out of an alliance or consortium of individuals and from a variety of organizations that were really interested in this manpower shortage, workforce shortage worldwide. We're experiencing some of that in the United States, but worldwide it's a much more chronic and acute problem as well. As this group came together, they devolved onto this mission to improve human health by increasing access to quality diagnostic pathology and lab services by lowering the barriers to quality education and enriching the educational resources available to the global pathology community. Now, there are many people that are trying to do similar sorts of things, but this combination of low barrier and a rich resource is vital. Now, a lot of this grows out of what we've learned from COVID, where we had to engage in pathology education via social distancing. Well, the social distance of 6 or 12 feet or 3 rooms down the hallway is not all that different from a continent away that we've discovered. So this notion also drives impetus from the fact that we know now, because of COVID, that what goes on in a wet market in Wuhan can and does drastically influence our lives as individuals across the globe. Time zones and thousands of miles away, nevertheless, actions in remote sites and among strange populations can have a dramatic influence on our lives. Well, one of the responses to that, as I indicated, was this outpouring of pathology resources to enable remote education. Some of these were going on long before COVID came along, and others were the mother of invention at the time of necessity. So the virtual grand rounds, the increased number of study sets and traffic on Twitter and Facebook and YouTube. But some, like Pathcast, were around for years before this, and many of these whole slide study sets and so forth. The thing about these is that these are very democratic, and they're also very economic. Virtually none of these require an investment other than having a communication device that is internet capable. And with any of those, then you can begin to gain access to these kinds of educational materials from anywhere at any time. Well, that's a real key opportunity for us. So what OPEN intends to do is to take this mishmash and tangled group of ropes and strands and threads and posts and videos and so forth and make some sense out of it. Take these high quality lectures, take this content and make it available to potential trainees, existing practitioners at no cost. So to take this mess and make some sense out of it. Well, to do that, we need to have a view of what's there, and we need to begin to impose some organization or provide an avenue to develop the ability to see where the resources are and access them in a way that's going to be fruitful for the individual and ultimately be fruitful for the society. So we take this maze of postings and material that are just coming daily in increasing numbers and provide a structure and a sequence and a perspective on them that allows us to do this. So this curriculum will include a lot of these freely available source materials. It will include digital slide case files from many sources, and often these are things with a recorded video evaluation or discussion. Couple that with a limited number of live mentoring sessions, both video-wise or otherwise, to interact and engage and to build networks, and assessments of progress and competency. So here's where the digital slide comes in and where the virtual connection and the sharing of that material makes possible something truly remarkable, something that was totally inconceivable a decade ago. But in addition to those things, we're looking to do more. So we recognize that there's going to be some gaps. We've discovered what some of those are, and we've begun to try to fill those. We're also very mindful of the fact that this is not something that someone can just do in their closet. They need mentorship, they need contact, and that can happen both synchronously, simultaneously, or it can happen asynchronously. We want to encourage networking and engagement amongst our learners and amongst our faculties, our suppliers of the content, because pathology is a team sport. In addition, if we're really going to impact manpower, workforce, we're going to have to support efforts at credentialing and licensure with those entities that control access to those kind of services. Now, when we're competing against no access or no services, that may be easier than competing against existing structures, which is not what we're trying to do. Our aim is to compete against non-consumption, or to provide services where previously there have not been any, or where previously it was of lower quality or of no limited quality, so that we expand the market rather than trying to compete with places where pathology is well established, where training programs are readily available, and where the supply is sufficient. Well, let me just tell you about this a little bit. For those who are in established settings, we can provide enrichment and complementary completing materials. We can help them gain access to things that are not available locally. We can provide access to educators that might not be able to travel, as well as to refining skills, expanding new skills. But for those who are in a position where there may be no training program, Lao, for example, well, we believe that we're going to be able to take someone from a essentially ground zero post-medical education status to enable them to achieve a basic level of competency, to enable them to compete against the non-consumptions. And by providing network and proctoring and support, that they can do so without causing harm to the patients. That's our commitment. Now, one of our early engagers here is Dr. Ngai. She comes from an established setting, but with very limited experience. And so she's eager to engage with the content and the material that we can provide, and is already helping us to learn how to do this well. In fact, that introduces me to one of our pilot projects where we're learning how to do this, and that is with the Da Nang Oncology Hospital. But this is also engaging with other partners, specifically the International Gynecologic Cancer Society, which is doing some very similar things with training of gynecologic oncologists. And so the notion of virtual training for gynecologic pathologists was a very easy jump for them. So we're providing a one-year training program in gynecologic pathology to their pathologists and trainees. And we're going to measure our outcomes by the scoring improvement of these pathologists over the course of instruction. And we're also going to look at the number of cases which come to tumor board that require a diagnostic change on further review, because we feel like that's going to be a good measure of improvement in quality as well, based on experience. So even though the hospital looks new, which it largely is, the training up to that level of newness is still lagging a little bit. Now, in this process, digital pathology is a key role. It can help us to train more people remotely, of course, to increase the effectiveness of the specialists that we're working with, access for them to these specialized cases, and access to expertise. But if this is bidirectional, that would be ideal. And that can be either via fixed digital images, which are sent for review, streaming video microscopy, or even best of all possible worlds, digital whole slide images to be reviewed from the source to the mentor, the trainer as well. One of the things that we've learned, however, is that, and this comes largely out of the work of these three individuals out of Harvard Business School, writing in the prosperity paradox. They make the point that drivers for innovation and improvement that are within the realm work best, that innovation within the economy, within the social setting is the ideal point of innovation, because that then leads to energy and impetus to pull in the needed resources and the needed tools, the needed infrastructure to create and to provide the services that are currently not available. So our second pilot began with a simple question: what do you wish you could do that you can't do now? That was a simple ask, but it was a very profound answer. So Professor Tao in Ho Chi Minh City said, well, we need to be able to provide urine cytology as an option for follow-up of bladder cancer, but we don't know how to do it or have any experience with it. We're not sure if our equipment will work for that. So we said very willingly, let us help you. Let us see what we can do to help you. And thus began the ABCs pilot, standing for the Open Asia Bladder Cancer Screening Project. We engaged several participants on the western side of things. Michigan, Arkansas, Oklahoma, all had specialists willing to step up and help and to contribute with this. And the University of Medicine and Pharmacy in Ho Chi Minh City as the local site project owner. The first step was to develop a method that would be available and provide solid diagnostic material. Well, they don't have the economy to use ThinPrep or SurePath or some of these other more standard liquid-based materials, but they had other methods. And so verifying that their method or that their means of handling liquid specimens was going to work was a very key step to inspect their protocol and so forth and provide that. And then we begin to deploy the training model of both asynchronous remote learning sessions as well as mentored virtual sessions. Now, if these need to be followed on by insights in live sessions on site, one place or the other, that may happen. But we believe that most of this is going to be able to happen virtually. And in this process, we're going to accrue durable training materials that will be usable for future sites and for the expansion of this effort within Vietnam, the target country. And then obviously we're going to measure competency. This is going to require real-time observation, real cases, as well as competency assessments and examinations, if you will. Well, then you just repeat that cycle. You allow Ho Chi Minh City to replicate that training for Da Nang, for Hanoi, for Gan Ta, for Tra Vinh, and other places where there may be the capabilities, but not yet the knowledge or technical skill to be able to do that. Well, so what are our next steps? Well, that's part of the reason I'm talking. I'd like you to know about this possibility, and we'd like to engage with pathology educators. we'd like to begin to curate and create more content that can be utilized in this way. We want to continue to dialogue with those who are prospective users, prospective sites. We have a lot of places in Africa, Cambodia, Laos, other places that we're looking at and beginning to develop relationships there. But we need to find out what they need and help them to pull in those resources so that they can more fully train their people. We want and recognize the importance to engage with organizations. The Digital Pathology Association is on board with this. We're hoping that other organizations with a keen interest in pathology education will likewise step forward and provide support, both intellectual, in-kind, and potentially even other resources as well. We need to fill the gaps in terms of content and create robust assessments that will truly reflect capabilities. And then we want to make sure that our portal is streamlined and capable. That's still in development. We have some strong leads moving in that direction. And finally, we recognize that we're going to need to partner with other stakeholders, funders, to assure sustainability in this process. And we need to get the word out. So we'll be doing more of these kinds of presentations as we accrue more results. I appreciate you listening. And if this is something that resonates with your soul and heart and you'd like to engage, please reach out to me. If you'd want to contact directly any of our various project team leaders, here's their contact information. Your curriculum team is Raul Gonzalez and Cameron Mirza, two noted educators. Matt Levitt and Ngop Tran are leading our IT platform and the Open ABC pilot project. And if you're interested in organizational relations and funding, Shahavi Chauhan at the ASIP and Dan Milner from ASCP are both keenly engaged and willing to help. So thanks so much for joining me. I appreciate your interest. If you have questions, please don't hesitate to reach out to me and let me know what is on your mind about this project and how you'd like to help and contribute. And I look forward to hearing from you. Thanks so much for being with me.